I'm Sarah Beth Bradley. I'm one of the nurse practitioners at the Community Medical Clinic. I've been here for about a year, and I wanted to talk to you all today about something we offer our patients called diabetic circuit training. This is offered to our diabetic patients, so patients that do have a diagnosis of diabetes going by one of their labs called an A1C. An A1C gives us an average blood sugar reading over the last 3 months. Patients with diabetes usually have an elevated A1C level, and the goal for us is to get that level down. In order to do that, one of the things we offer our patients is a group education class. What we do is we offer 2 classes per month, and each class consists of 4 patients. These 4 patients spend about an hour with a diabetic educator or nurse practitioner. We discuss different food options for them. We talk about calorie counting. We talk about how to build a proper plate, how to pair carbohydrates and proteins to prevent abnormally elevated sugar readings. We talk about foods for our patients. A lot of our patients can't easily go to the grocery store and buy fresh produce or lean meats due to lack of funds or transportation or other reasons. So in this group setting, we talk about issues that they face and come up with ways to help them eat a little bit better. For instance, a lot of our patients are having to eat at fast food restaurants, and so we discuss healthier options. For instance, if they go to KFC, we may suggest they get green beans and grilled chicken as opposed to the fried chicken and macaroni and cheese or mashed potatoes. We also give our patients little goodie bags for coming. In that goodie bag, they get things such as measuring cups to help us and them appropriately determine serving sizes so that they're not overeating. We also give them mirrors so that they can check the bottom of their feet. A lot of diabetics do suffer from neuropathy, which is a condition that can lead to decreased sensation in the extremities, especially the feet. So it's very important for them to monitor their feet to check for wounds or other things that could lead to infection. We also provide notebooks so that they can keep a log of what their intake is as far as food goes, as well as their blood sugar levels, which really helps us narrow down, okay, this is what you're eating is leading to elevated blood sugar readings, and also preventing episodes such as hypoglycemia, which would be low blood sugar readings. The other thing we offer these patients is a food voucher to go to the Mobile Nutrition Center, and they have been so gracious and kind to work with us with these patients to provide them with foods that won't elevate their sugars, and giving them lean meats such as chicken breast and fresh vegetables. It's so far, I think, been a great success. After that initial, it's about 1 hour doing that food education. We then separate the patients, and they have a one-on-one session with one of the nurse practitioners where we can discuss a more individualized plan for them. We've seen a great success with this. We've seen patients that are actually lowering their A1Cs. Patients are now able to verbalize what they should be eating. Some patients still come in and they say, I know my sugar's elevated today, but it was because I had carbohydrates last night. And so even though sometimes we may still have those elevated sugar readings, the patient is able to verbalize why they're having them, and I think that helps them better understand what they need to do to change.